post-surgical scars. Is scarring after surgery something you're dealing with? Here at Beyond the Needle Med Spa, we specialize in treating post-surgical scars, and this is something we see too far and often. One of the biggest issues I notice is that many surgical providers neglect to properly prepare their patients for potential scar outcomes. Unfortunately, post-op care for the skin is often overlooked, and that's where we step in. There are two common types of post-surgical scarring. First, hypertrophic scars, raise but remain within the boundaries of the incision. Two, keloid scars. Those grow beyond the incision of the line and are more stubborn to treat. In about 90 to 93% of the cases we see, patients develop hypertrophic scars, which are typically easier to correct. Our protocol: we begin before we treat. We always prep the skin with 4% hydroquinone and a 1% retinol, and even at times a tretinoin. This preconditioning phase is what helps regulate the pigmentation and helps with skin healing. Once ready, treatment typically includes microneedling with radiofrequency, either using Morpheus 8, Virtue RF, or similar devices. Ablative CO2 lasers resurfacing over the scar. Post-procedure care, home to support healing. Patients are usually seen again after 4 to 6 weeks for their second session, and again 4 to 6 weeks later for their third session. We always recommend minimum of 3 treatments. That's where we see the most visible improvements. In more severe cases, such as overly tight suturing, aggressive scar formation, patients may require 4 to 6 sessions to achieve optimal results. Our goal is always the same: to help you feel confident in your skin again, with scars that heal flatter, smoother, and with less visible